Come in.
I'm gonna wash my hands. Hi, Mr. Piatek. How are you doing today?
I'm doing well. How are you?
I'm good, thank you. My name's Liz. I'm a nursing student at Harper College, and I'm going to be doing a hair, nails, and skin assessment on you today. Would that be all right?
Yes.
Okay, I'm gonna start off by asking you two questions. At first, do you have any history of any skin conditions or skin cancer?
No.
Okay, and do you use tanning booths at all?
No.
Okay, good. So we're gonna start off the skin assessment by just looking at the upper chest and the extremities. And there's no signs of any pallor, no pale color, no arrhythmia throughout the upper and lower body, no signs of cyanosis, no blue, and then no jaundice, no yellowy color. So then I'm gonna feel for the temperature and moisture. His upper extremities are warm, dry. Lower extremities are warm and dry also. I see no edema present in the upper extremities or lower extremities. I see no bruising throughout his body. He has a couple of scars on his legs. He has one on his right upper thigh and then one on his left lower thigh, both from accidents when he was younger. And he has like some healed, not bruises, but healed lesions on the left knee and the ankle. And then I'm going to check the motility of the skin turgor. So the motility, the skin is easy to pull up in the skin turgor. It retracts back to normal in less than a second, which is normal. And then he has a couple of macules on the upper part of his chest, but that's about it. Okay, and then I'm going to move on to his hair. Can you scoot forward? First, actually, let's do the back. We're gonna turn around and look at his back. Lighting's kind of bad. But his back, on the top he has much more macules than he did on the anterior part of his chest, and he also has some pustules throughout, some back knee. Not too many, but they're spread diverse, but no moles, nothing elevated. Okay, so turn around. Okay, so now we're gonna do his hair. You're tall, scoot down. We're gonna do his hair. So we're gonna look at the color. He has like dirty blonde hair. His hair distribution is even throughout his head, no balding, no patching. So I'm going to separate his hair and look through and look for any lesions or infestations. I see nothing. You don't have any itching or anything bothering you with your scalp?
No.
Okay, and then his hair it's thinner. It's smooth. Okay? Okay, that's it. And then the last part of the examination we're gonna do is the nails.
No.
So we'll start with these ones. So we're gonna look at all the nails, and they're pink, they're warm. The capillary refill is less than 1 second. We are gonna check the profile sign for clubbing, and the nail bed is less than 160 degrees on the fingers. And his fingers are kind of rounded. He has 1 or 2 that are flat, but for the most part, they're rounded. And the nail beds are pink, which is normal. Okay, and then same thing for the toes. The toes are more rounded, which is normal. Nail beds are pink, they're warm to the touch, so are the upper extremity nails. And the temperature is good. Okay, and so we're gonna complete the assessment with some patient education. So you don't have any moles or lesions, it doesn't look like upon examination, but for future use, we have a tool that we call the ABCD. So just for you or your family to do self-examinations for skin assessments. For if you do end up having a mole, what we do is we use ABCDE. So A is for asymmetry. If you see a mole start to become disproportional on the sides, or The board or each is different, then that would be a concern. B is for border, also if the border is uneven. C is for color. Color would be if in the actual mold there's multiple colors, like a little black, a little brown, not just one color throughout. That would be a concern. D is diameter, so we won't want them to be under 1/2 inch or under the size of a pencil eraser. If it was bigger, that would be a concern. And then E is either elevation or enlargement if you see the mold getting bigger, or if you see it start to elevate off of the skin more. Okay? Do you understand?
Yes.
Okay. And this completes the skin, hair, nails assessment.